Hello and welcome to a social media live from the WHO. Today's topic is air pollution, climate change, and health. My name is Walter Owens. I'm a social media officer at the WHO. As always, for those who don't know the content of today or the way we do it is you can ask a question in the comment section of the social media channel that you are watching at, or if you are on Twitter, just use the hashtag AskWHO. I'm joined today by Dr. Maria Nera, who is the director at the WHO of Environment, Climate Change and Health. Welcome, Maria, and thanks for joining us.
My pleasure, Walter. Thank you.
So first of all, before we start, maybe to introduce the topic, what is the impact of climate change on health?
You know, we have some critical prerequisites for health: access to food, clean air, water, and shelter. So those four things are absolutely fundamental for good health. And climate change is putting at risk all of those pillars that are so critical for our health. So that's why we are so concerned, the health community, because climate change is already affecting all of those fundamental bases for our health. It's affecting the quality of the food and even the amount, because we will have difficulties for agricultural production, and therefore it might even take to malnutrition. We will have changes on the transmission of certain infectious diseases. We will have contaminated water, and we will have people migrating, moving, and therefore losing their shelter because of the difficult extreme weather events or natural disasters that climate change is bringing us. So health will be and is already very much affected and will be very sensible as the global warming continues.
Yes, thank you. So that's quite a long list. And if you consider the individuals who might be affected by climate change and the impact on their health, who would that be?
Well, let me make it clear. Everybody's at risk of climate change. I mean, it's all of us, whether you live on a rich country or a middle income or very low income country. But it's true that obviously the most vulnerable will be those living in countries where you don't have a good health system, you have poverty already, you have a very bad shelter and living conditions. Obviously, those will be the more affected ones, including children. And ironically, those are the ones that are not contributing to create this problem. There are the ones that are, their contribution in terms of emissions is very, very low. But according to our studies, clearly those are the ones that will be the most affected in terms of infectious diseases, or this lack of agricultural production, or this contamination of the water, or extreme water event, for which they are less protected, they have less mechanisms of protection, and their social network or their health network is definitely not the same as you can have in richest countries. But we are all at risk.
Yes, we're all at risk, and especially children, unfortunately. For those who've just joined, we're talking about climate change, air pollution, and health. I'm joined by Dr. Maria Nera. If you want to ask questions, because this is your opportunity to ask questions on that topic, please leave a comment, or if you're watching us on Twitter, simply use the hashtag AskWHO. So Maria, you touched upon it at the beginning, that climate change is more and more causing severe weather. How is that impacting the health of individuals?
Well, imagine with all of those extreme weather events, floods or droughts, any natural disaster, obviously there will be a direct impact on people's health. If you have flooding, maybe the agricultural production will be destroyed. People will be forced to migrate. So we will have double problems in aggravating the situation that maybe those people were already on a poverty situation and creating a double problem. We saw heat waves in Europe, even in Europe very recently, in rich countries. That's why I was saying at the beginning that everybody is very much affected. And with all of those natural disasters, we will see as well, with the rising of the sea level, we will see as well people forced to move and to be displaced because they cannot live anymore in those places that now, the conditions are not there to continue on your living. So massive displacement, people losing their ground, losing their capacity of produce food and having contaminated water and extreme heat waves, which are affecting very much, particularly the elderly and the very young people. So nothing positive in that sense on how climate change is already affecting our health.
Yes. So there's a whole range of issues that will be affecting us. And I read also that due to the change in weather, you also have, for example, mosquitoes who are spreading. So is there a chance that diseases that might have been not existing in a certain area of the world 10 years ago might be spreading there? Is this a possibility due to climate change?
Yeah, I'm sure you are thinking on malaria or dengue, for instance, which are transmitted by vectors, by mosquitoes. Those mosquitoes, those diseases transmitted by vectors will have better conditions. With this global warming, they will have places where before they didn't have the conditions to reproduce themselves, and now they will have perfect conditions. We saw malaria cases in mountains in Kenya, for instance, where we didn't see it before because the temperature, the rainfall, and the humidity and the weather will not allow those vectors to reproduce. And now they have the perfect conditions. So we see a potential increase, and we see already in some places more cases of malaria and dengue, for instance, transmitted by vectors, by mosquitoes. But at the same time, we see as well what we call in WHO the main killers, malaria, malnutrition, and tuberculosis, for instance. Those diseases are very climate sensitive. So at the moment you have a change on temperature, you will have more diarrheal diseases and cholera, for instance. Water will be more easily contaminated, and you will have water scarcity as well. So as you can imagine, we are fighting to tell the international community that climate change is not just an environmental issue. It's fundamentally a public health emergency, and we need to react because our health will be at risk from many fronts, from many risks.
Yes, thank you. We have a first question from Mushfik Mahi, who's asking if climate change is speeding up at the moment and what impact that might have on health.
If it's speeding up, if it's
yes. Is it increasing?
Yes, unfortunately, we are all going to, the world will be now concentrated on the COP26 in Glasgow, and a lot of expectations are there. But at the moment, all the scenarios and the recent reports by UN agencies are telling us that we are producing more emissions than ever. Mm-hmm. So even if the Paris Treaty has been signed and the countries are now hopefully more conscious about what is happening, we are still, and even after the COVID-19, our emissions are still, the trend is increasing. And if we don't take a very, very dramatic action now at COP, we will reach maybe the 2.7 or 3 degrees increase instead of staying below the 1.5 degrees Celsius that we wanted to keep. But we are on a very bad trend, and that's why health has to be the engine now, the motivation for people to understand that this is very serious and they need to take more action. It's not a question of protecting the planet or protecting the glaciers or protecting the polar bears. It's about protecting our health. And I think we need to say that so many times until people understand. And well, I hope that in COP, this COP26, this health message, this health argument will be heard by all the politicians and policymakers and head of states, and they will do something for our health, to protect our health.
Yeah, definitely. It's high time to act now. And since you mentioned COP26, would you like to explain what it is? Because I think some of our viewers might not be aware of it.
Well, COP means Conference of the Parties, and 26 means something very sad. Means that the countries have been meeting for 26 years to negotiate and to reduce CO2 emissions, I mean, greenhouse gases emissions, and to take agreements, to negotiate what those agreements will be. And, you know, from a public health point of view, we are getting very impatient because the agreements that they are taking are still not very ambitious. They are not proving to give the results expected. And as a consequence of that, our health is very much at risk. One of the big things that we are bringing to this COP26 in terms of health is the following. And I hope that everybody will, you know, join us on saying this very loudly. The same causes that are responsible, the same emissions that are responsible for the global warming, for climate change, are responsible as well for air pollution. So in big part, I mean, more than 75%. So it means that when you are combusting fossil fuels, you are not only contributing to climate change, you are as well polluting the air we breathe. And this is the huge connection. The air we breathe at the moment the quality is so bad that is killing. The exposure to this toxic air that we are breathing at the moment is killing 7 million people every year. Can you imagine? 7 million deaths every year for many years now, caused by exposure to toxic air that we are breathing. And you know, we cannot stop breathing, that's clear. So we need to breathe, and we breathe air that is definitely not clean and not healthy and is killing us. Therefore, we concentrate on saying, tackle the causes of climate change, because that will result on a decrease on air pollution, and therefore we will save many, many millions of lives.
Yeah. I've lived myself in a city with very, very bad for air quality for a lot of years, and I know the impact that it can have. But maybe you could explain to our viewers what's the impact of breathing bad air and air pollution on health, especially for adults, but also for children and pregnant women.
Yeah, well, you know, as I say, you when you breathe, and you can't stop breathing, so you need to put into your lungs more or less 10,000 liters of air every day. Can you imagine? So because we breathe very often, so approximately 10,000 liters of air will come through your nose and then get into your respiratory system. And as you can imagine, this will be the first to be affected, your respiratory system. So you will have obviously chronic respiratory diseases like asthma, acute ones like pneumonia, and acute chronic pulmonary diseases. But you will have as well lung cancer if you are exposed for a long time. But those particles that are toxic and that we are breathing, they do not stay only on our lungs. They are so teeny, so small, that they will go into our bloodstream, and from there they can reach any organ in our body and causing damage. And essentially what they will do is ischemic heart disease, means affect our cardiovascular system, you know, our heart. They will cause stroke. You know, I'm sure that everybody knows that disease. And those particles are so horrible that they can go through the placenta. So if you are pregnant, if a woman is pregnant, that will affect already the brain of the fetus, even before that baby will be able to breathe anything and before even was born. So as you can imagine, is the cardiovascular system, the respiratory system, and now we know that is affecting as well our cognitive function. So we might be less intelligent if we are affected by air pollution, and cognitive system, and is linked as well to diabetes. For children, they will create problems not only when they are children, but for the adult, and this damage will remain for a long time.
So really everybody is affected by
Yeah.
bad air quality and air pollution. And sadly, again, children are probably on top of the list. I was wondering if you could tell us about the sources of air pollution. Why is the air quality bad?
Well, one of the main sources is, as I was saying, the combustion of fossil fuels. When to generate electricity or mobility, we use at the moment very pollutant fuels. We use fossil fuels, which means petrol, oil, and gas, and we do a combustion. That combustion will generate all of those particles that will contribute to the global warming, and at the same time will contribute to the air pollution. This is a big source of climate change and air pollution. Traffic, transport, obviously. So our sources of energy are so fundamental that, as responsible for public health, we need not just to talk about diseases, but we need to talk about what causes the diseases. And in this particular case, we need to look at which sources of energy our governments are using. Because if they are very dependent on the combustion of fossil fuels, our health is very much at risk. So we need to make sure that we are doing a transition to clean sources of energy like renewables, and then our health will be very much protected. Other sources of pollution are coming from industrial processes, from incineration of waste, are coming from agricultural processes, and the animal the production of meat, for instance. And the energy we use in our buildings, our mobility. But essentially, as I say, burning fossil fuels is one of the most important sources of air pollution.
Okay. We have a question from Janice Jacobs. It relates a little bit to what you just said, and she's asking how urban planning can help with climate change and air pollution.
Well, very, very much. In fact, we are saying here in WHO, when we talk to mayors, we are always telling them, consider yourself as a kind of minister of health, please, because the decisions as a mayor that you can take on transport, particularly public transport system, because if you have a good public transport system, an affordable one, a cheap one, the one that responds to the needs of your citizens, you will disencourage the use of private cars, and therefore you will reduce the pollution in your city, and you will reduce as well the climate, the contribution to the climate crisis. So planning a sustainable transport system is fundamental. Then the urban planning, thinking on us as individuals, as citizens, and not on thinking on the cars, because at the moment all our cities are planned around the cars, parking spaces, places for the cars, and the citizens, we don't have a place. We cannot walk, we cannot bike, we cannot have social interaction, because our cities are completely, our urban environments are completely dedicated to the king of the city, which is the car, the private car. That has to change, because it's affecting very much our health. We have a sedentary lifestyle, which is contributing to non-communicable diseases. We breathe air which is toxic. We have mental health issues because we don't have social interaction. We have injuries due to the traffic density. And honestly, our cities, the big cities today, are not livable. And in addition to that, if there is an infectious agent like COVID-19, SARS-CoV-2, or another that is transmitted the way we saw that SARS-CoV-2 is transmitted, if you are overcrowded on a city, then you have the perfect conditions for any infectious agent to be transmitted.
Yes, thank you. It's true that the way the cities are made, once you travel and you see different cities, there's a different way to commute, and you've got parks, or you've got urban transportation, and it really does make a huge difference. And of course, we would like to reduce air pollution as much as possible, but some people are living in cities where it's a reality that the air they breathe is almost toxic. So what would you recommend to these individuals? Is there a way you can protect yourself or mitigate the health impact?
Well, unfortunately, as you say, we need to breathe the air that is available. I mean, you cannot choose the quality of the air in the city where you live. You can measure it, you can be aware, but there is very little you can do to change that quality. But there are many things you can do. One is use your vote, I mean, your political power, and choose the authorities that will have on their program maybe an intention to reduce air pollution. And I think the politicians these days and mayors are very sensitive to this argument. They realize that the citizens, they hate to breathe this polluted air. They are more and more aware of this problem, and they are putting a lot of political pressure on mayors and politicians. So this can give them votes if they choose the right decisions and they reduce the pollution of the air we breathe. So use your vote. Second, of course, try to use the public transport system whenever it's available and respond to your needs. And we need to disincentivize the use of the private car whenever it's possible. So we need to be, as citizens as well, very conscious that we are contributing a little bit. At home, you need to look at the energy efficiency. You need to have maybe isolated buildings or the way you use the heating and the cooling system on a more efficient way, making sure that you are not losing the energy. Switch off your devices. If you can bike, do it. Educate your family and your children, and do on your community more awareness raise. And do it for your health, because this is really affecting our health. So we need to, as citizens, we need to put pressure on the politicians who can take decisions on the big scale, but as citizens, we can contribute as well, at least as individuals, not to aggravate the problem. Be very conscious as well of the recycling, fight for having green spaces on your city and use it. And maybe as well, we need to rethink about the way we live in our urban spaces, and maybe we want to reconsider living outside the cities and be closer to the green spaces and the rural area.
Thank you. Now, obviously, to combat climate change, if we go back to the climate change topic, there are so many things that we can do, and I think we need to act on a lot of little things to move the whole issue of climate change. And John Deng is asking us, what would be the first steps for combating climate change?
The first is probably, the first is to be convinced that you want to do it. And I'm afraid we are not yet there. I'm afraid we still have governments, not fully committed. And that's why the pressure of citizens from a political point of view is extremely important. And we need to move that. The second is probably one of the most efficient one will be to do this energy transition to clean renewable sources of energy as soon as possible, and of course on a holistic and well-planned way. But we need to accelerate that process, because the combustion of fossil fuels is literally killing us. That's why we are going to COP. As the health community, and by the way, we take a health argument for climate action to COP26 in Glasgow, which has been signed by 47 now millions of health professionals from all categories in the health groups, sign and back up. And the health argument for climate action is very positive. What we are saying is not catastrophistic. It's not saying climate change is killing all of us. No, what we are saying is the other way around. If you look and if you tackle the causes of climate change, the health benefits will be enormous, will be fantastic. You will breathe cleaner air, you will have healthier diets, and you will have a more active and healthier transport system and mobility. So only these three incredible benefits will save us a lot of lives. We can save millions of lives every year. And important as well, because for some people the economic argument is extremely important, and it should be, we could save our economy, because ironically at the moment the world is spending more than $400 billion every year, $400 billion to subsidize fossil fuels, which are the ones causing a lot of disease. And those diseases are going to our hospitals, and our hospitals and our health system is paying $5 trillion to cover, to compensate, to take care of those who have been sick because they were exposed to air pollution created by subsidies to fossil fuels. So can you see that the argument? Instead of spending $400 billion on subsidizing something that is killing us, please use that money to accelerate this transition to clean mobility, clean sources of energy, and better urban and healthy planning.
Yeah. So there are really a lot of reasons for combating climate change. Of course, health is one of them. And I wanted to ask you, or give you the opportunity, if you could tell us what WHO is doing in terms of air pollution, but also in terms of climate change.
Thank you, Walter. Air pollution, I hope that everybody is aware that very recently we presented the new air quality guidelines. So we are looking at 6 key pollutants, which are very harmful for our health. And we provide the recommendations in terms of the levels at which our health will be protected. And if we go above those levels, we will have more diseases. Those levels that we are recommending now for those 6 pollutants are very ambitious, but are the ones we need to protect our health. So we need, WHO is very much present on the air pollution agenda by obviously providing the scientific evidence, providing those levels, engaging with any actor to help them to with the interventions needed to reduce air pollution and therefore protecting our health. And of course, we are training the health professionals. The health professionals need to be engaged as much as possible in all of this. And we are bringing, this is on air pollution. But as I say, for us, air pollution and climate change and biodiversity are very much linked, because the 3 of them can be tackled on a similar way. And then our health will be very much benefited if they take the right decisions and they reduce emissions, or will be very much at risk if they are slow on their response and they don't take ambitious and important political decisions that they need to reduce this global warming, which is very, very dangerous for us.
Yes. I'm aware of the time, so I'm just going to ask you one final question. As we mentioned, it's COP26. And the health community really has a strong argument for combating climate change. What are your expectations of COP26, or what are your hopes of COP26?
Well, our expectations and hopes are very, very high, even if we know that maybe it's not going to happen. But we need to make sure that people understand that climate change is affecting our health. Therefore, we want countries to allocate funds to adapt the health system, the healthcare facilities to the impacts that climate change is already having. So this is already happening. No matter what, climate change is already affecting us. So we need to projects of adaptation to climate change. Second, they need to reduce emissions at least by 50% by 2030. That's not even ambitious. I think it's the minimum we can do. taking into consideration that we are in front of a very, very serious crisis. And as the human society, we need to respond. And there is no other response than tackling the causes of this horrible crisis that is in front of us. And third, I hope that measuring the benefits for the health of the people that this reduction in emissions can have will be a very strong motivation and for positive action and for creating the movement among citizens that we need to push for more action and reducing those emissions. And we could save so many lives, particularly on those 7 million deaths caused by air pollution, if we implement the recommendations of WHO in terms of the levels of pollutants. We could save at least 80% of those 7 millions, means 5.6 million of lives that could be saved. I think this is a very good cause and mission and a reason to fight and to be there with a lot of hope and energy and even very high expectations.
Thank you so much, Maria. I'm sure a lot of people around the world are really hoping that COP26 is going to be finally the turning point. I would like to thank you again for joining us today on this social media live. And I would like to thank our audience also from around the world. We had viewers from the USA, India, Argentina, Ghana, Jordan, Colombia, Thailand, Brazil, Nigeria, South Africa, and many more. Thank you for joining us. And if you are affected by climate change or you would like to leave a comment, please do so. We'd love to hear what you have to say. And thank you again for joining us. And until next time, stay healthy and goodbye.
Bye-bye.